Hello friends, welcome back to Shiji classes, and in this video we are going to discuss bisphosphonates. First of all, we will discuss the drugs. I have simplified this topic and I have tried my best to cover this topic and also make you remember easily. So let's focus on it. First of all, the drugs. They are oral and the IV drugs. In this, the first one you have to remember a name, that is dronates. Just remember the dronates. And then the oral one, you have to remember three words. First one is the ln, the second one is the eben, and the third one is the rese. With this we have completed the oral drugs. Alendronate, ibendronate and risedronate. In the IV you have to remember only two drugs. First one is the prami and the second one is the zolen. Pramidronate and the zolendronate are the IV. And the isedronate is the one which is both IV as well as oral. In this, the zolendronate is the longest acting drug. And also the zolendronate is the most potent drug among the bisphosphonates. With this, you have remembered the drugs of the bisphosphonates. Now we will discuss the mechanism of action of bisphosphonates. First of all, you have to remember that the bisphosphonates exerts anti-resorptive effect. It means it decreases the bone resorption. Now we will discuss in detail the mechanism of action of bisphosphonates. The bisphosphonates, here is the short form of bisphosphonate, BPN. It is having high affinity with the calcium. After binding with the calcium, it gets deposits into the bone. And in which side of the bone? In the remedullary side of the bone. After that, it is ingested by the osteoclast. So, bisphosphonates now are inside the osteoclast. What is the next step? The bisphosphonates are inside the osteoclast. After that, it will exert two effects in the osteoclast. The first effect is the direct apoptosis of the osteoclast. And the second effect, it interferes with the mevalonate pathway. Mevalonate pathway is responsible for the cholesterol bile synthesis, which is a requirement for the osteoclast survival. In the mevalonate pathway, it inhibits one enzyme. Which is that enzyme? That is farnesyl pyrophosphatase. It will inhibit the farnesyl pyrophosphatase enzyme. And also the third action is it inhibits the osteoclast activation. Thus, we have covered the mechanism of action. So, in short, I will explain to you that when the bisphosphonates are get inside the body, then it has having the high affinity for the calcium. So, they get deposits in the bone. In which side of the bone? In the remedullary side. After that, the bisphosphonates are ingested by the osteoclast. Now, the bisphosphonates are inside the osteoclast and that will exert two effects on the osteoclast. First one is the direct apoptosis of the osteoclast. The second is it will interfere with the mevalonate pathway of cholesterol bile synthesis, which is a requirement for the osteoclast survival, and inhibits the farnesyl pyrophosphatase enzyme. It is asked in many entrance exams. Now we will discuss the uses of bisphosphonates. You have to remember Just 3 uses. First of all, you have to remember the word osteoporosis. The second one is the Paget's disease. And the third one is the hypercalcemia. First of all, you have to remember these 3 words: osteoporosis, Paget's disease, and hypercalcemia. And now we will discuss this in details. First of all, osteoporosis. There are 2 types of osteoporosis in which the bisphosphonates are used. The first one is the postmenopausal osteoporosis. And the second one is the steroid-induced osteoporosis. In both postmenopausal and the steroid-induced osteoporosis, the bisphosphonates are the drug of choice. They increases the bone mineral density and thus reduces the risk of fractures. Now, in the steroid-induced osteoporosis, it is combined with the oral calcium carbonate. Next, Paget's disease. Here, the treatment of choice is the IV zoledronate. Remember, the zoledronate is the longest acting and the most potent drug. The Paget's disease is a disease in which the lytic lesions and the blastic lesions are present. And hence, here the zoledronate will decreases the bone pain and the alkaline phosphatase level. Next, we will discuss the hypercalcemia. The hypercalcemia of malignancy or the hypercalcemia of parathyroidism. The bisphosphonates are used. In the hypercalcemia, for the long-term treatment or the management, the bisphosphonates are used. So, what we use in the acute hypercalcemic conditions? In the acute hypercalcemic conditions, we use IV saline and furosemide. Here you have discussed all the uses of bisphosphonates. So, a quick revision of this. First, you have to remember these 3 things: osteoporosis, Paget's disease, and hypercalcemia. In the osteoporosis, there are 2 types: postmenopausal and steroid-induced. What they will do, they will increases the bone mineral density and decreases the risk of fracture in the osteoporosis. In the Paget's disease, IV zoledronate is used. Zoledronate is the longest acting and it decreases the bone pain and as well as the alkaline phosphatase level. In the hypercalcemia, it can be of hypercalcemia of malignancy or hypercalcemia of parathyroidism. For the long-term treatment, we use bisphosphonates. And what we use in the acute hypercalcemic conditions? IV saline as well as furosemide. Okay, so now we will discuss the side effects. Now, some nausea, vomiting and diarrhea, you can write this because they are the dhanya for the medical students. Here also you have to remember it can cause peptic ulcer disease. Now we will come to the main side effects of the bisphosphonates. First of all, you have to remember esophagitis. 4 things you have to remember. The first one is the esophagitis. The second one is the hypocalcemia. Why hypocalcemia occurs? It is the most common in the bisphosphonates because it decreases the bone resorption and hence hypocalcemia may occur. Third one is the fracture of femur, and especially the shaft of the femur. This condition is rare And the fourth one, we will study about the IV zoledronate side effects. In the IV zoledronate, first of all, it is given IV. So what you can remember? Infusion reactions. In the infusion reactions, fever, malaise, uveitis and myalgia can be there. The second one is diarrhea. Zoledronate causes diarrhea. And the third one is osteonecrosis of the jaw. Osteonecrosis of the jaw. Only at the high doses of zoledronate. And also after the dental procedure, osteonecrosis of the jaw can occur. Okay, so now you have to remember esophagitis, hypocalcemia, fracture of the femur, especially the shaft of the femur, and fourth one is the zoledronate, IV zoledronate, infusion reaction, diarrhea and osteonecrosis of the jaw. Esophagitis. What can we do to prevent this side effect? First of all, while taking the drug, you should drink plenty of water. The second thing you can do is keep standing 30 minutes after taking the drug. And please don't eat any food before and after 30 minutes of this drug. And also it has to be taken empty stomach. This should be remembered. Second one is the hypocalcemia, which occurs due to decreased bone resorption. Third one is the fracture of the femur shaft. And fourth one is the zoledronate, infusion reaction, diarrhea and osteonecrosis of the jaw. Last one, we will discuss the contraindications of the bisphosphonates. In the people whose GFR is less than 35 ml per minute, bisphosphonates are contraindicated. This should be remembered. Okay, so now we have completed our topic bisphosphonates. If you found it helpful, then please like, share and subscribe. Thanks for watching.